Okay, so let's go ahead and get started. Welcome to the virtual info session for the medical assisting program here at Elgin Community College. I appreciate you taking the time to hear a little bit more about this exciting new program. My name is Kelly Marlin. I am the medical assisting program director, and I also have been a medical assistant for 16 years. So we're going to start with what is a medical assistant. Medical assistants perform the vital role of gathering and translating a patient's issues and needs to a physician. So the best way to explain that would be you are the physician or the provider's right hand person. You're going to help them in all of their daily tasks, which is exciting. It's a fun job. It's always changing, but in a good way. You're seeing new things every single day. Some of the duties that you will have, clinically speaking, are taking and recording vital signs. So that person that gets you from the waiting room and takes you back and takes your blood pressure and your pulse and your temperature. You're going to take medical histories. So you're going to find out more about the patient, if they've had surgeries, what they're there to see the doctor for that day. Preparing patients for examination, including drawing blood, also known as performing phlebotomy on the patient, and administering medications, giving injections. So lots of interesting clinical work is within the scope of a medical assistant. And the other exciting thing about a medical assistant is you're not just trained in the clinical aspect of the job, you're also trained in administrative roles, such as checking patients in and out, scheduling appointments, maintaining medical records, understanding billing and coding for insurance purposes. So you are a multifunctioning staff member in a doctor's office. So you can fill lots of voids, which also means lots of job opportunity. So a little bit about the difference between a nurse assistant versus a medical assistant. This is a question I get often. I've gotten it from nurses who work with nurse assistants all the time, and they're like, I don't know what the difference is. So I decided to make this slide just to kind of talk about it a little bit more. So medical assistants perform clinical duties similar to a basic nurse assistant or a BNA, also known as a CNA, but they have a larger clinical scope, meaning they're trained and able to do more on the job. So MA students are trained in phlebotomy, injections, including vaccinations, assisting the physicians in in-office procedures like inserting an IUD or helping to remove a cyst from a patient. They're also trained in administrative duties, including billing, coding, insurance, and making sure their skills are more versatile and increases their earning potential. So you're just going to be able to earn a little bit more than someone in a BNA or CNA role, and also have a larger scope of practice. Medical assistants often work in outpatient settings, assisting a physician or a provider, where BNAs or CNAs are most commonly employed in hospital settings and assisted living facilities, assisting a nurse. So I hope that clarifies some of that. And as I talked about before, medical assisting duties, these are some administrative duties that you will be trained on here in the ECC program, and using computer applications, answering telephones, welcoming patients, updating and filling patient medical records, coding and filling out insurance forms, scheduling appointments, arranging for hospital admissions and laboratory services, and handling correspondence, billing, and some light bookkeeping. And then clinical duties, as I touched on before, taking medical histories, explaining treatment procedures to patients, preparing patients for examination, assisting the physician during those examinations, collecting and preparing laboratory specimens, performing basic laboratory tests such as a COVID swab or a strep swab, instructing patients about medication and special diets. Patients love to hear about how they have to lower their cholesterol and that they need to cut out some of their favorite foods. You get to be the fun person who delivers that. preparing and administering medications, including by intramuscular, intradermal, and subcutaneous injections. So those are just a couple different forms of an injection that you will learn about in the program. Transmitting prescription refills, so talking to the pharmacies, making sure people have what they need to get their prescription filled. Phlebotomy, which is drawing blood. Taking electrocardiograms, that's a test, a very basic test that can be run in a doctor's office to check and see if the heart is working appropriately, and wound care and dressing changes. So a day in the life of a medical assistant. Medical assistants typically work Monday through Friday during the day with the possibility of working some nights and weekends. This is obviously a great perk. There are a lot of jobs in the medical field that require you to work in a hospital setting, where you're working Christmas, you're working New Year's Eve, you're there on Sunday mornings. And now there is some opportunity for medical assistants to work in like urgent cares and places like that that might give them more expanded hours, but typically medical assistants are seen in outpatient settings, meaning doctor's offices, clinics that are open more of that Monday through Friday, some Saturday hours. So it gives you a little bit more flexibility to have a good work-life balance. At least that's how I personally feel. Can be home to see the kids in the evening, things like that. The morning will consist of getting prepared for patients to come into the office, including coordinating with other staff and preparing exam rooms. As patients arrive for their appointment, it's the MA's responsibility to room the patients and communicate patient needs to the physician. Throughout the day, the MA will have multiple duties, including rooming patients, which is what I kind of touched on before, which is getting the patient from the waiting room, taking them to the exam room, getting a set of vitals, asking them why they're there, and running any tests that they need. And then calling patients with results in between rooming patients and performing lab tests and assisting the physician as needed. And then the MA will end the day by making sure that all time-sensitive duties have been performed and exam rooms are cleaned and prepped for the next clinic day. Here I put together some traits of a medical assistant. Organization is a huge one. As I just touched on the different duties of a medical assistant, you can see that that list is detailed. So being organized is going to be important, making sure that you're getting the right patient and putting them in the right room and making sure the right provider is seeing them. Time management. We've all been to the doctor's office and had to wait far too long, unfortunately. So in my experience, part of my duty as a medical assistant was being a good time manager and also trying to keep that physician on time, reminding them which room they needed to go into and that they had a patient waiting and they needed to get off their phone. And attention to detail. Again, this goes back to organization. This is something like I talked about, calling patients with test results. So you might have a day where you're rooming patients for a physician and they're also wanting you to call certain patients with test results that they've reviewed. So attention to detail would be saying, okay, so I have 2 messages waiting for me. One of them is to call someone with a normal cholesterol result, and another one is to call a patient who tested positive for strep throat and needs to be started on an antibiotic to make them feel better. Well, let's think about it. Like if we're paying attention to detail, we're saying, okay, let's prioritize that patient that obviously is probably not feeling well and needs that prescription. So we're going to make sure that gets done first and foremost, and just be able to, pay attention to those small details and make sure that we're serving the doctor and the patient appropriately. And then a liaison between the patient and the provider. This is such a big part of the job. You're going to be rooming that patient. You're going to be finding out why they're there, and they're going to be telling you what's important to them that gets addressed at that visit. And you want to make sure that you are giving that information to the physician and helping them see the patient for what they need to be seen for and prioritizing what's important. And then empathy. This is something any kind of health, most jobs really require empathy, but especially working in the healthcare field, you're going to be working with patients who don't feel well, are scared, are maybe getting results that they are nervous about, or they're there with a sick child and they're freaked out, and just being empathetic. And even though you're busy and you've got a lot on your plate, remembering why you're there and ultimately you're there to help the patients. This is super detailed, so I'm not going to go into every single aspect of this, but this is essential functions of a medical assistant. Communication skills, we touched on this already. To be able to be an effective medical assistant, you need to be able to verbally and in writing use appropriate terminology with accuracy and efficiency. Again, these are things that we're going to teach in the program, but these are just some standards that are going to be important to be successful at the job. Recognizing, interpreting, and responding to nonverbal communication, being able to interact and communicate appropriately with individuals of all ages, genders, race, socioeconomic, religious, and cultural backgrounds. This is very important. You are a caretaker, you're a healthcare worker. So you need to treat everyone the same, even if you might not agree with something that they have written on their shirt or agree with something that came out of their mouth. Like, you need to treat them as you would anyone else. Effectively communicate with and take direction from a healthcare provider. We talked about that before. You are working, as the right-hand person for that physician. So you need to be able to have open communication with them. Skill and knowledge to be able to use a computer and electronic health record system. That is, again, something we're going to learn in the program. We actually have a simulation electronic health record system that will be part of the curriculum here at ACC. Motor skills. So these are just some physical things. There's a lot that goes into this, but the best way to sum it up is you need to physically be able to perform CPR, meaning you need to be able to, if needed, hopefully you will never have to, but get down on the ground, give compressions, be able to bend, squat, reach, be able to lift and carry. Now, I say up to 50 pounds or exert up to 100 pounds of force. Now, keep in mind, there are safe ways to lift and carry. I don't expect you to deadlift 100 pounds by any means, but you just need to be physically able to, with the help of your coworkers or lift equipment, be comfortable lifting those weights. Moving throughout the clinic, you're on your feet a lot, you're doing a lot of repetitive movements. So this is definitely a physical job, so just something to keep in mind. And one thing that I didn't mention that was on that last slide was traveling to and from academic and clinical sites with reliable transportation. That's definitely something to keep in mind as well. Part of the program does require you to do hours in the field. So you just want to make sure that you are able to do that as well. Sensory skills. This kind of ties into the communication skills, but giving and receiving clear verbal communication, including in response to an emergency. You need to be able to hear instructions and deliver verbal or audibly by instructors and fellow classmates. Being able to detect soft noises, like when you're listening for someone's heart rate or blood pressure. Comfortable working in close proximity to patients, and feeling comfortable with bodily fluids, including blood and needles. This is something I like to mention because it might sound like, yay, I watched Grey's Anatomy and now I want to work in the healthcare field, which is great. I mean, I can't say enough about working in the healthcare field. I absolutely love it, but that does mean that you have to work with patients and actually touch them. So just something to keep in mind. And for myself personally, one of my biggest apprehensions when I started my MA training program 17 years ago was being around blood and needles. I was a little freaked out by that. And I have to say that the more I did it, the more comfortable I felt, the better I dealt with it, and went on to draw, 20, 30 patients a day with no problem. So just something, I don't want you to be freaked out or discouraged, but just something to keep in mind. And then behavioral skills. Demonstrate the emotional health and stability required to fully utilize your intellectual capacities, demonstrate good judgment, and render appropriate care. The best way to sum that up is, that you're behaving appropriately and using good judgment, and remembering that you're a student who is representing Elgin Community College, and when you're out in the field working as a student medical assistant, that you are making appropriate care decisions. And also then once you're a medical assistant, you're making sure that you're using those important judgment skills as well. If a student's performance appears to be hindered or minimized by the abuse of drugs or alcohol, we do have a policy in place that would be enforced. Obviously, it is never okay to be under the influence of anything in class or at school or on a site. So, or once you have a job and you're on the site. Students may not smoke during class time hours. You must demonstrate integrity and honesty in all matters. Maintain confidentiality as taught in class and legally binding in the HIPAA Act 7. So we'll go more into detail on that once the program starts, but that is protecting patient privacy, not talking about patients' information to other students or really to anyone that's not involved in their care. Following policy and procedures required by academic and clinical settings, and adhering to Elgin Community College's Code of Conduct and Discipline. Why choose a career in medical assisting? So diverse career options. I touched on this a little bit before, but you can work in primary care. That would be like a family practice doctor, internal medicine, someone you go to for your physical every year or when you're not feeling well, or a specialty doctor. Like I have experience working at a cancer center where I worked with oncology and hematology patients. We have a couple sites that are going to be taking our students for clinicals that are orthopedic. So they're going to be dealing with broken bones and injuries like that. There's all different specialties you can go into, which makes, there are tons of career options, which is exciting. And being trained and certified to work in the healthcare field in as little as 12 months. So this is a 3-semester, 12-month program. So it starts in the fall, you do fall classes, spring classes, and then over the summer you have one class. And then along with that class, you're also doing externship hours. And I'll go more into that. But you would start in August and you would graduate in August. So 12 months and you're done, which is exciting. Fulfilling career that allows you to make a positive difference in patients' lives. This is something I always touch on. This is kind of what got me into the field. Was I'm going to age myself here a little bit, but prior to becoming a medical assistant, I worked in retail management. I worked for Blockbuster Video. And again, there is nothing wrong with working in retail. I think that can be very fulfilling for people. But for me personally, I just didn't see that as my future career. And I got into the medical field working as a medical assistant. And I knew I was impacting patients on a day-to-day basis. And it just makes you feel good. Like, even though you might have a hard day and maybe the physician, is frustrated about something, and in turn you get the slack on that a little bit, or a patient's not happy with something that they hear. But ultimately, like, each day you are making a positive impact on patients' lives, which is really fulfilling. It's stable with consistent hours and expectations. There are tons of job opportunity out there. I get calls. I literally just got a call today from a clinic that's like, do you have any recent graduates? We have a position that we're looking to fill. And that happens a lot. And this program hasn't even started yet. And I feel bad saying, I don't have any graduates yet, but just wait. So wide-ranging skill set makes a career as a medical assistant a valued healthcare professional. Competitive pay with growth potential. And as I spoke on, medical assisting is one of the nation's fastest growing careers. I put together a little thing here from the U.S. Bureau of Labor Statistics. From 2020 to 2030, medical assisting is expected to grow 18%, other healthcare support occupations 16%, and total occupations just 8%. So there is a lot of job growth. And as far as now, this is also pulled from the Bureau of Labor Statistics, is the median pay for the Chicago metropolitan area. So the median pay is $38,000 about per year, $18.71 per hour. This is something that I'm going to kind of contradict a little bit. I think this is on the lower end. This is from 2021. And so most likely this data was pulled even from like late 2020. I can tell you that this number has increased. I know some of the local big hospitals here in the area are starting new medical assistants without any experience for $18.50 to $20 an hour, and that's with a sign-on bonus of $2,000 to $3,000 that would be given out over like a 6-month period. So there's a lot of incentive to become a medical assistant and to work in the medical assisting field right now. So they're and that pay is, going to continue to be competitive. Medical assisting program here at ECC. So as I spoke on, it's a 3-semester, 30 credit hour certificate program. You're going to take courses to teach you administrative skills and effective communication. And you'll get the opportunity to shadow a medical assistant in an outpatient clinic during your first semester. So in this first fall semester, you're going to do a 1-day shadowing experience where you're going to just get to follow a medical assistant and see what a day in the life truly looks like in the field. And then your clinical skills and hands-on learning will be offered in several courses, including a 160-hour externship where you will get to work in a real-world medical setting out here in the community to get all that hands-on experience so that you are ready to work in the field. And the MA students will be learning in a recently built state-of-the-art campus lab and clinical and classroom space. It is planning on being finished here in the next couple weeks. I've seen it recently. It looks amazing. I'm so excited. You will have the opportunity to learn in a simulation lab that's built to replicate a physician's office with a reception area, exam rooms. We're going to have all the equipment that you're going to see in doctors' offices. It's going to be a great learning environment. And successful completion of the medical assisting program will allow students to sit for the registered medical assisting exam through American Medical Technologists and start their career as a medical assistant. So I'm going to go into that in a couple of slides, but you will be able, successful completion of this program will allow you to sit for that exam. So this is a course outline. So fall semester, you're going to take medical terminology and you're going to take a communications course. Those are 2 things that are offered here already at ECC. And then you're going to take 2 medical assisting specific courses, Intro to Medical Assisting, which will be taught by yours truly right here, Kelly Marlin. And then medical billing and coding, which will be taught by an adjunct instructor that I just hired. And he is great. He's a medical assistant right now that works out in the field, and he's going to be teaching that course. And those courses are offered Tuesdays is the Intro to Medical Assisting course, and Thursdays is the medical billing and coding course. And then the terminology course and the communication courses have varying times. I think the medical terminology course is actually just online. And then the communication course, you have the option to either take an online course or an in-person course. So just something to keep in mind because that's this coming fall, so soon. And then spring semester, you're going to take 2 specific medical assisting courses, medical assisting patient care and medical assisting clinical procedures. Those are going to be our heavy lab courses where we're going to be doing tons of hands-on learning, all the fun stuff. And then you're also going to be taking phlebotomy, which is where you're going to learn how to handle lab specimens and draw blood. Tentatively, the schedule obviously has not been completely planned out, but tentatively there'll be Monday, Tuesday, Thursday. So it's a little bit heavier in the spring for time wise. And then summer semester, you're going to be doing your externship. That's the 160 hours out in the field. And then you're going to be doing a capstone course, which is just like a couple hours, 1 morning a week, where we're going to be learning interviewing skills. We're going to work on resume building, and we're going to be preparing you for that registered medical assisting exam. And then the externship, and this is something I always like to preface by saying the externship is something where you will need to be available during the day, during the week. So Monday through Friday, depending on where you're placed, most likely it's going to be like a job. You're going to be working at the site, Monday, Tuesday. If we have a capstone course, maybe Wednesday morning, you'll need to go Wednesday afternoon, and then Thursday, and then Friday might be like a makeup day if for some reason you needed to miss a day. So just something to keep in mind for availability purposes. And then this is where we're going to talk about certificate versus certification. So completion of the medical assisting program at ECC will earn the student a vocational certificate in medical assisting. Students who have earned their MA certificate will then be eligible to sit for the national certification exam through AMT. So you are not required to be a certified medical assistant in the state of Illinois, but I'm going to tell you that most employers, especially the bigger companies that are going to pay you better, are going to ask that you be certified. So that is why our program, which is going to earn you that MA certificate, is also preparing you to take that certification exam. And we offer it right here on ECC's campus. It can be taken 30 days prior to graduating. So I'm going to hold your hand through that process, and we're going to make sure as many students as possible take that exam, because it's just going to make you, it's going to make you more appealing to employers. It's going to give you that distinction, higher compensation. All of that goes along with taking that exam and having that certification behind your name, not just having the certificate. Program admissions and requirements. So let's take a look here. So this is our admissions process. If you're not a current student at ECC, the first thing you want to do is apply to Elgin Community College, submit official transcripts, request an evaluation, and then you're going to want to meet with an academic advisor. Sarah Bazzelli is our academic advisor, so that's who I would recommend. She's specializes in the health professions programs. And so I think that's the best way to start. And then once you've done that process, then you're going to go ahead and you're going to apply to the program with a health professions application. I would go ahead and review your application, make sure that you've met those minimum competencies, which I'm going to talk about on the next slide. And then once you've met those competencies, you're going to review the handbook, ask any questions that you have, and then once you've returned the agreement page in the handbook, you will be formally admitted to the program. Once all the available spots are filled, students will be notified and placed on a waiting list. The program is accepting 20 students for this fall semester. I can tell you that there are a few spots left, but I do currently have 12 students enrolled. So just something to keep in mind. And I have a couple already in the admissions process. So if you are interested, this is the time to go ahead and get that process started. So these are those minimum competencies. So the best way to explain this is you just need to be ready to take college courses. So there's no prerequisites. You don't have to take a certain class prior to doing the MA program here at ECC, but you need to meet the criteria to be college ready for reading, English, and math. And I can send this PowerPoint to anyone that would like it. All this information is available on the website to kind of go into more detail. And if you have specific questions, I can talk to you about that as well. And then again, I'm not going to go through this whole process. It looks like a lot as far as health requirements, but I promise most of this stuff you've already done. These are all requirements that the clinical sites have. So because of that, we have them for the program here. One of the things I am going to mention is that you do need to be fully vaccinated for COVID. That is something that is a requirement for all the health profession students at ECC. So that's just something to keep in mind. All the other vaccinations are things that most likely you already had for your physicals as a child. You might have to get, your records or get titers drawn just to make sure that you are good to go. And again, I can send you this information so that you have a little bit more detail. Another thing that you need to do is complete a CPR training prior to starting the program. And I have information for you regarding that as well. Once you get accepted in the program, I'll send you resources on how to sign up. You need health insurance. You'll have to have a physical form filled out. Those are just kind of the basic health requirements. And then these are the program costs. So this is prior to any kind of financial aid, or as we're going to speak on in a little bit, any kind of grants or financial assistance that you receive. So these are just straight costs that I've pulled. So tuition is around $4,300. And then there's going to be some initial admission costs, like that admissions fee, Castle Branch, which is like the tracker for all those vaccinations we talked about. You'll need a background check and a drug test. Health insurance, again, if you don't have it, that price is really going to vary, but I would hope, fingers crossed, that most of you guys have health insurance. Physical exam, these are all things that these are costs if you aren't able to put them through your health insurance as well. So keep that in mind. And then, as we talked about, CPR, textbooks, and we'll on the next slide, I kind of broke it down per semester for textbooks. Program scrubs, because you will need to purchase scrubs for the program. If you don't have a watch with a second hand, that's going to be important. A blood pressure cuff with a stethoscope, and then certification exam costs, and then laptop or Chromebook. Now that cost varies if you don't have one at home. The ECC library does rent them for free per semester. So that is something that would be available as well. And I'm really working to try to get a Chromebook cart with Chromebooks available for students to use in class. But that hasn't happened yet. So hopefully TBD. So this is the MA program expenses breakdown per semester. So this is, you can kind of see the tuition per semester. You can see that there is a little bit obviously higher admission health requirement costs in that first semester, but then you won't need to pay anything additionally after that. Same with textbooks. You can see like the textbooks that we are using for the MA specific classes are the same for every semester. So you're going to purchase two textbooks and a study guide, and we're going to use those throughout the entire program. So you won't have to repurchase books each semester. So that's something to keep in mind as well. And then attendance policy. Students are expected to take the instructor coursework and each other seriously. Students are expected to arrive on time for classes and be fully prepared. I am so excited for this program to start. I am pumped to like help you guys be the best MAs you can be. But there is a ton of information that I have to instill in you and make sure that you are confident in before we send you out on that 160-hour externship. So that's why it is so important that you are prepared, that you are taking the coursework seriously, you are doing your homework, you are showing up to class ready and on time, because we just don't have a lot of wiggle room. There's, that's the perk of this program, is that it's only 12 months, but it's only 12 months. So that's just something to keep in mind. I know it might seem like a big commitment, but it's just for 12 months and then you're done and you are trained and ready for this new career, which is super exciting. So it just is going to take that commitment. And again, on that same note, I understand that, students might need to work while they're attending the program. I think it's going to be doable to possibly work full time in the first semester, but that second and third semester, it's going to be tricky. So that's just something, again, as you're planning and thinking, to keep in mind as far as how you're going to find a balance with the program. So it is a full-time program, and there will be demand of a time commitment in the classroom and also out of the classroom. And as I spoke on before, during the summer semester, you will be expected to be available Monday through Friday, 8 to 5. So just again, as you're planning ahead. Dress code, our scrubs are red. So you're gonna just, be bright and beautiful and stick out. And then those can be purchased through the ECC bookstore. You will use your student ID as a picture ID, and those uniforms will be expected to be worn when we're doing clinicals and also when we're doing lab work in the classroom as well. And there's more information in the handbook about additional dress code. The pants are black. You don't have to purchase them through the bookstore. You can purchase any black scrub pants as long as they're, appropriately fitting and clean and, nice looking. That's totally fine. And then these are some ECC resources. Again, I can send you any of this information, so don't feel like you need to be scribbling this down. But academic advising, financial aid, admissions, tutoring services, and wellness services. And this is my contact information. And then I'm going to go ahead and I'm going to stop sharing my screen because I'm going to have Savannah speak a little bit from the grant services.
Thank you, Kelly. Hello, everyone. So my name is Savannah, and I oversee a few of our grant-funded programs here at ECC. We are the future workforce leaders. So the purpose of our grant is to provide young adults such as yourself the opportunity, guidance, and support to make sure that you make it through your program that you're interested in at ECC. So with that being said, the medical assistant program that will be new in the fall is one of our approved grant programs, which means that we can, if you're eligible for the program, we can pay for your tuition. So all of that money that Kelly was just mentioning in regards to the tuition, the fees, the license or certification fee that would need to be paid, uniforms, things of that nature, we can pay for that all. In addition, we have supportive services that we can also assist with. So when Kelly mentioned that you would need to be able to come back and forth to campus or for your classes or even out in the field for clinical sites, that is something that we can either provide bus passes for or gas cards to help reimburse or offset those costs while you're commuting back and forth to either your classes or clinical sites. We provide so many additional services, even if, because we do understand that students do need to work, we hope that that barrier of needing to pay for the classes, you would come through our program so that we can offset some of those costs. But in the case that a student wants to work as well, we are able to offer paid work experience, which is part-time work, but we would pay typically between $15 to $17 an hour for any part-time work experience that you may be interested in the healthcare field, if you feel that you still need a little bit of additional training or funds to help support you or your family at home. So I always think of us as the best kept secret because I think of myself when I was in school, I went through the same program as a young adult, not for MA, but for something else because we cover so many programs. So I highly encourage anyone who is interested to just reach out to us. And we're on campus, we're in Building K, but we're not as connected to the other buildings as we would like, of course. So if you're ever interested, you can visit us at Building K, or you can email us at wioa@elgin.edu. Kelly also has my information so that at any point you are interested or would like to know any more information, you can reach out to her as well, and she could reach out to me, and then we can go ahead and start that process. But I look forward to anyone that is interested in learning more about our program and going through this new MA program, as I think is going to be so wonderful to have it here at ECC.
Thank you so much, Savannah. I appreciate you sharing that information and just echoing what she said. Yes, feel free to reach out to me and I'll make sure that I get you connected with her. And I'm going to update one of my slides to include that information. So for the next info session. So thank you so much, Savannah. I really appreciate you taking the time to be here and tell these potential students another perk to this wonderful program. So
absolutely. Thank you for having me.
Thanks. Did anyone have any, oh, you know what? I'm going to stop recording.